Hi, welcome to the first episode of You, Me, and HAE, a four-part podcast series. I'm your host, Debbie, and joining me today is Tequoia, a licensed insurance agent who also happens to have hereditary angioedema, or HAE. HAE is a rare disease caused by either the body not making enough of a protein called C1 esterase inhibitor, or when the body makes enough of this protein, but it doesn't work right. This results in periodic swelling that can be painful, unpredictable, and life-threatening. This program is sponsored by Farming Healthcare Incorporated. The speakers have been compensated for the presentation of this information. The information contained within this podcast is for educational purposes only and is not intended to be medical advice. This episode will discuss experiences of people living with HAE. It is important to recognize that these experiences may not be representative, as every person with HAE has a unique disease course. So again, my name is Debbie, and I'm going to be your moderator for 4 informative and interesting conversations about HAE. I'm a wife and the mother of 4 amazing daughters. 2 of my daughters also have HAE. I am an English as a second language, or ESL tutor. And actually, I recently had the opportunity to travel to Japan to reunite with some of my former students, which is a huge life highlight for me. In these podcasts, we're going to hear personal stories about living with HAE and how the disease can impact your daily life. We're going to talk about the challenges with having HAE and discuss approaches to overcome those challenges, including leaning into your available support network. We're also going to talk about approaches that may be helpful when talking with your healthcare provider about HAE and HAE treatment options. But in this episode, we're going to highlight one patient's journey to her HAE diagnosis and the initiation of on-demand treatment. This is the medication you use once a swell starts, and sometimes it's referred to as a rescue therapy. So I'd love to introduce you to our guest today, Tequoia. Tequoia, tell us a little bit about yourself.
Well, hello. I am
Hey,
Tequoia. How are you? Well, to begin, am a mother of 4 as well. I am also a wife of almost 22 years now. So I'm a little excited about that's coming up soon. And also grandmother of 3 wonderful little munchkins. I'm currently into collecting, I would say, unique sneakers. I love sneakers, but really funky, unique type of sneakers is a hobby. So that's kind of what I'm currently into.
so
And
Tequoia, before
yeah,
you start talking about HAE, I have to find
yeah.
out a little bit more about this. So first of all, I'm jealous that you're a grandmother. I have grand dogs and grand cats, but I'm still waiting on the birth of a baby, hopefully sometime in my future. I don't know. And now I want to know about your sneakers. So tell me
Sneakers.
about the most unique sneaker you have collected.
So I had a pair of sneakers, and when I say unique, I don't, I always go into the store for the shoe that is not what kind of everyone would look at. So I don't go for the name. Like, I'm not a brand name girl.
Okay.
But this one particular pair that I would say I probably kept for a really long time, and then my family was probably like, get rid of them. They had, they had multiple colors, but they also had, get this, you ready?
Uh-huh.
Snakeskin, leopard print, and zebra print. This is all on one shoe. And then like all the accessories were like gold. Now I didn't wear them often, but it was one of my, I would say the shoe that probably got that collection started, where it
Okay.
was like, I'm going to start wearing shoes that is a statement piece. So more or less, I'm not really into clothes. It's like, let's talk about what's on my feet. So
So you do wear them. That was my next question. You don't just look
I
at them, you wear them.
I do. I've learned to, in younger years, I didn't. I was more of a collector, but as I've gotten older, I've learned like life is short. So I better start wearing and using this stuff before I can't. So I started reluctantly wearing them, but yeah, I've been recently kind of stepping out in them, and it's been pretty cool to actually see them on my feet versus on my shelf. So it's been a really cool journey, but Yeah, it's slowing up a little bit. It gets expensive, so I'm just the wearing right now, not really in the collecting part.
All right. Now let's get back to the purpose of this podcast and let's hear about your HAE journey.
Yes, because I could talk about shoes all day. Now, first, with my diagnosis, I was first diagnosed with HAE when I was around 29. This was about 15 years after I first experienced swelling episodes.
That is a long time. And I totally understand that. It took me a long time also to get a diagnosis. So let's start with those first HAE symptoms that you experienced. How did your symptoms show up? When did you decide to talk to a doctor about what you were experiencing?
So my story, Debbie, is pretty interesting. So I unknowingly had symptoms of HAE starting in adolescence. As a little girl, I would always have these belly aches, and they were pretty frequent, but they would subside after a few days. Now, my mom and I, we thought with these particular belly aches, they were really painful. They gave me nausea. They made me throw up. I was pretty miserable, again, adolescents. We're thinking, little girl. Now, again, my mom and I thought it was associated with me starting my menstrual cycle because a lot of women in my family started it at a very young age. But now looking back, I notice a pattern that where if I had a test for school or something that I was stressed about, it could even be a crush on a boy. That's when I noticed that I would have these belly aches a little bit more often. Fast forward it to a little bit more into adulthood when I broke my ankle and I slipped. Well, I did it slipping on some black ice. Initially, I thought it was just a clean break. I'd be in a cast for a bit and then healed. Boy, was I sadly mistaken. Now, this ankle situation continued to swell, and I was in a cast for approximately 8 months. Now,
Wow.
usually a break is about 6 weeks, maybe a little bit longer depending on how bad, but 8 months I was in a cast. Now, this right here, that situation definitely raised now not just flags, red flags. Like this is not normal. I happened to share these experiences with my cousin and found out that they also had incidents of unexplained belly swells. My cousin had gone to an immunologist and had been diagnosed with HAE and suggested I make it an appointment.
Wow, what a journey. Tequoia, I can imagine that it was challenging to experience those belly aches and painful swelling throughout your adolescence and not know what was going on. Thank goodness you were able to lean on your family for support and in turn were advised to see an immunologist. Great advice. So, building on this, what was your journey like from that first swell to being told you have HAE? When did you first learn about HAE and how did your doctor describe it?
My initial diagnosis took a while. It started with allergy test. I went through unnecessary surgeries and procedures because my doctor was not familiar with HAE. These included having my gallbladder removed, undergoing several colonoscopies, and other diagnostic tests. Ultimately, my diagnosis came from a comparison between my symptoms and a family member who had HAE. The doctor told me that I have to do my own research and that my condition was not curable and she couldn't help me any further. I felt overwhelmed, but my spouse was willing to learn through available websites and by coming to doctor's appointments with me to ask questions and advocate on my behalf. Now, having a support system meant so much to me as I navigated my newly diagnosis. Whatever he was learning, I was a sponge to that information. And I learned over time that HAE is a rare disease characterized by swelling episodes. Swelling in the body is controlled in part by a protein called C1 esterase inhibitor, often just called C1 inhibitor. When your body does not produce enough C1 inhibitor or produces C1 inhibitor that doesn't work properly, the processes that cause swelling are overactive and lead to HAE swells. Now, this is why HAE is sometimes referred to as C1 disease. The swelling experienced during an HAE episode is from fluid in your blood vessels leaking into other tissues. There are three types of HAE. Now, type 1 is when your body does not make enough C1 inhibitor. Type 2 is when your body makes C1 inhibitor, but it doesn't work properly. And the last type is when you have normal, functional levels of C1 inhibitor, but experience similar swelling events to HAE. Now, this is called HAE with normal C1 inhibitor, but I sometimes just simply say HAE normal. Now, this is the type of HAE that I have. This type of HAE can be hard to diagnose because there is not a single standard test that can be used to confirm the diagnosis. While HAE can be inherited or passed down from your family, it can also show up in someone with no family history of the disease.
Although several of my family members had experienced unexplained swelling, my daughters and I were the first ones to receive an HAE diagnosis. And we all
Oh,
have type 1 HAE. So that means
okay.
our bodies don't make enough C1 inhibitor, which leads to our HAE swells. So once your doctor told you that you have HAE, how did the discussion of treatment go?
Well, because HAE normal is less understood, there was a lack of attention to my condition from my doctors and even in available online materials. I experienced a cycle of immunology referrals because several specialty doctors in my area did not know how to help me or weren't familiar with HAE. I sensed that these doctors were also frustrated by the lack of understanding and treatment for my disease. Now, after this cycle of referrals, I did find an immunology doctor familiar with HAE that stressed the importance of me always having access to an on demand treatment. Now, on demand treatment helps relieve swelling and associated symptoms during an HAE swell. My doctor noted the importance of having access to at least 2 doses of on demand treatment to manage HAE swells as they occur. Now, this is so that swelling can be treated early as soon as it's recognized and does not get worse, so that I can return to my daily activities as soon as possible. Over several years, I cycled through specialty doctors and trips to the emergency room, and I even tried different medications to see what would work for me. I was holding out hope, but it was very disheartening at times. My husband and I attended conferences, and in one particular conference, we found out about an on demand HAE treatment called RUCONEST. We spoke with my new doctor and after this conference, and he agreed that RUCONEST may be a good option for me to try.
RUCONEST, C1 esterase inhibitor, recombinant, is an injectable prescription medicine that is used to treat swelling and or painful attacks due to hereditary angioedema, also known as HAE, in adult and adolescent patients over the age of 12.
And Debbie, as we're both taking RUCONEST, I'm curious. What did you learn about RUCONEST from your doctor?
My doctor first told me how RUCONEST works. I learned that RUCONEST increases functional C1 inhibitor, addressing the root causes of an HAE swell. I found out that RUCONEST is dosed at 50 units per kilogram with a maximum dose of 4,200 units. Also, no more than 2 doses should be administered within a 24-hour period. Then my doctor shared efficacy data for RUCONEST. In the clinical trial, about 9 out of 10 patients successfully stopped an HAE swell with just 1 dose of RUCONEST. The study included 44 patients. In the open label extension study, 44 patients experienced 170 HAE swells and received RUCONEST. In this study, 97% of swells needed just 1 dose of RUCONEST. In the primary clinical study, patients saw symptom relief with RUCONEST in 90 minutes versus 152 minutes in the group taking inactive liquid. My doctor always lets me know the safety information. In clinical studies, anaphylaxis was a serious adverse reaction that was reported. This serious event happened in a healthy volunteer who did not reveal their known rabbit allergy. The most common side effects that patients experienced were headache, nausea, and diarrhea.
What other information did your doctor tell you about RUCONEST?
Of course, my doctor also shared with me that I should not use RUCONEST if I have experienced life-threatening, immediate hypersensitivity reactions, including anaphylaxis to RUCONEST or to any other C1 esterase inhibitor product. She emphasized to call the doctor's office or the emergency department right away if I experience wheezing, difficulty breathing, chest tightness, turning blue, looking at lips and gums can be an indicator, fast heartbeat, swelling, faintness, rash, or hives. A serious side effect of life-threatening hypersensitivity or anaphylaxis was reported in a clinical study. I learned that you are not to use RUCONEST if you have a known or suspected allergy to rabbits or rabbit-derived products. It is always important to tell your doctor about all your medical conditions, including if you have a known allergy to rabbits. Before starting RUCONEST, I told my doctor about all of my current medications, as some medications, such as birth control pills and certain androgens, can increase risk of clotting problems. It is important to note that blood clots have occurred in patients receiving plasma-derived C1 inhibitor product. Also, be sure to tell your healthcare provider if you are pregnant, breastfeeding, or planning to do so. The most common side effects patients experienced during clinical studies include headache, nausea, and diarrhea. These are not all the possible side effects of RUCONEST. My doctor encourages me to tell her about any side effect that bothers me or does not go away. I can also report negative side effects to Farming Medical Affairs at 800-930-5221 or contact the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. If symptoms persist, a second dose of RUCONEST may be taken at your recommended dose, but you are not supposed to take more than 2 doses within 24 hours. For more information, please see the full prescribing information, including the patient product information, which is available at www.ruconest.com. There have been no well-controlled prospective studies for the treatment of acute HAE swells in people with HAE with normal C1 inhibitor. Therefore, the safety and efficacy of C1 inhibitor replacement therapy in this patient population are unknown. Tequoia, how has your experience with RUCONEST been since you started it?
After weighing all the risks and benefits, my doctor and I determined that Ruconest was right for me. But all patients with HAE should talk to their doctor to see if Ruconest is right for them. From route of administration to effectiveness, Ruconest has met my needs and aligned to my lifestyle. I can get back to things that matter knowing that I can rely on Ruconest to treat my swell.
Tequoia, you really had to persevere to get that diagnosis, and I'm glad you found a medication that works for you. As we close out our episode, do you have any final thoughts or insights you want to share about our conversation today?
Yeah, first I want to say thank you, Debbie, for having me today. I also want to say I am extremely blessed to have the strong support system and network that I have in my amazing husband, my children. They all are able to advocate for me, and I'm grateful. Just want to let folks know that finding your partner and your support system is very important. Don't be afraid to lean on them during difficult times. I know having HAE, there's moments where we don't want to be a bother, or we feel like we're a bother, but this is what I always say these people are for. Lean on them, use them for support so you don't feel alone, and that you are able to get through. I don't want to get emotional, but to get through each day and living a normal life as possible. Now, it may be a process to find a medication that works for you and a doctor that listens to your needs, but just stay hopeful and be tenacious. You are the expert on your HAE.
Wow, Tequoia, thank you. Thank you for this conversation and just being so open to discuss your HAE journey. It's been great to hear your story. I always learn so much when I hear fellow patients share their stories. I'm always amazed when I talk with other people who live with this disease about how different their journey is. And at the same time, I seem to pick up on similarities. We both took a long time to be diagnosed, despite having different types of HAE. And we also struggled with swells for a while before getting a rescue therapy prescribed. But in the end, we did both find a treatment that works for our situation, which has allowed us to be confident in managing our HAE swells. Listeners, Thank you so much for tuning in and engaging with us. In the next episode, we'll hear from Kelly as she shares her experiences living with HAE and how HAE swells can impact her daily activities. I hope you will join us.